this video, we're going to discuss the next part of the axial skeleton, which is the vertebral column. The vertebral column runs from the skull to the pelvis, but it does not include the pelvic girdle. So that's a lot. That is something that students a lot of times get confused on. So make sure that doesn't happen to you. It's also called the spine or the spinal column, but it has lots of different functions. It transmits weight of the trunk to the lower limbs, surrounds and protects the spinal cord, and provides attachment points for ribs and muscles. The flexible curve structure has 26 irregularly shaped bones called vertebrae that are in 5 major regions. So our next slide shows us our general characteristics. The regions are about 28 inches long, broken into 5 major regions. And a good way to remember this is if you eat breakfast, which is actually already listed on the slide. If you eat breakfast at 7, lunch at noon, and dinner at 5, that will help you remember how many vertebrae are in the first 3 sections. So the cervical region has 7 vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, and then below that, inferior to that, would be the sacrum, which is 1 bone. And during development in the uterus, there were 5 separate bones before that, which are now fused as 1 bone at birth. Inferior to that, there is a coccyx, which is also fused bones from 4 original bones. So it's important to remember that the vertebrae is not meant to be a steel rod. In fact, it's quite the opposite. It's meant to be able to easily bend, and it has 4 main curvatures in the column that help to increase resilience and flexibility of the spine. So it has 2 different curvatures. It has the cervical and the lumbar curvature, and the thoracic and the sacral curvatures. And a really easy way to remember this is to think about the development of the baby. So, one of the first things they do is they try to hold their head up, and then they try to stand. So that means that these are the secondary curvatures, and the ones that we are born with are the primary curvatures, which are the sacral as well as the thoracic curvatures. Our next slide is referring to the entire vertebral column, and the vertebral column itself, remember, is 26 irregularly shaped bones. Each of these vertebral discs that are between the vertebral bones are discs of fibrocartilage, so they kind of act like shock absorbers. And then all the vertebrae are numbered by the region that they're at and the specific number, with exception of the first 2. So the first one is C1, but it's got the name of Atlas. The next one, C2, is the axis. And the next 3 would be C3, C4, C5, C6, and C7. Then we begin with T1 through T12, L1 through L5, and then S1 through S5, and then the coccyx, which is 4 fused bones. So let's look at the general characteristics of a vertebrae. There are these cushion-like padded pads that are sandwiched between the vertebrae that again act as shock absorbers. So again, they are fibrocartilage. They have two main parts to them. They have the inside, which is what's called the nucleus pulposus, and that gives the elasticity and compressibility to a disc, but it's surrounded by what's called the annulus fibrosus. And the annulus fibrosus is an outer collar composed of collagen and fibrocartilage. So a lot of times when you look at the MRI report of somebody with a herniated disc, for example, in this case, it could be very well possible that there is a slight tear in the annulus fibrosus. And what that does is it causes the nucleus pulposus to stick out into this region, compressing one of these spinal nerves, which can cause radiating nerve pain. So we'll be looking at some of the parts of these bones, like the spinous process and the transverse process next. And in the very center, you can see a very small, fragile spinal cord, which remember is really the extension of the brain during embryonic development. For this clinical imbalance, this clinical homeostatic imbalance, we can see that any physical trauma can cause a herniated or a prolapsed disc. Commonly, people might say they have a slip disc, and that's pretty much what this is. But it usually involves rupture of the annulus fibrosus, protrusion of the nucleus pulposus, which presses on the spinal cord or nerves, causing numbness or excruciating pain. So we see the nucleus pulposus of an intact disc here, but in this case, you can see the herniated nucleus pulposus. So this region of it is actually putting pressure on the spinal cord, whereas up here, it's clearly not. So this can actually be very bad because it could be a central herniation, and especially it could put pressure on the entire spinal cord and lead to what's called cauda equina syndrome, which requires immediate surgery because those nerves are going to be responsible for control of the bladder. So usually when it's not, with the exception of cauda equina syndrome, it's usually treated with things like exercise, massage, heat, painkillers, or in the worst case scenario, surgical intervention at the last step. The next homeostatic imbalance are abnormal spinal curvatures that can be congenital or result from disease, poor posture, or unequal pull of muscles on the spine. And there's three that you need to know. The first one is scoliosis. A lot of times younger people will have this. It's an abnormal lateral rotation of the spine, usually in the thoracic region. And the key here is that it's lateral. The next one is kyphosis, which is also commonly referred to as hunchback. And it's an abnormal dorsal thoracic curvature common in people with osteoporosis, tuberculosis of the spine, rickets, or osteomalacia. And finally, the last one is lordosis. In lordosis, sometimes it's called swayback, and it's an accentuated lumbar curvature. Can result from disease, but it's also seen in men with pot bellies that drink too much beer, maybe, or have developed this belly over the years. This extra anterior weight is going to kind of pull the spine forward. And it also happens temporarily in pregnant women. A lot of times, especially during the third trimester, you'll see women are putting their hands on their hips to brace themselves against the lordosis.